Now to something positive. We've often been told that doctors are living gods. Rightly so, because they save mankind from suffering and sickness. They are heroes without a halo. I'm going to tell you about 5 doctors who belong to Delhi. They're now being hailed as heroes, in fact, angels on board. These 5 doctors from the All India Institute of Medical Sciences saved a child's life during a mid-air medical emergency on board a Vistara flight which was coming from Bangalore. They revived this toddler who had stopped breathing on the flight. The 14-month-old baby had a heart problem. He experienced a cardiac arrest on the flight and became unconscious, and was then saved by a team of 5 doctors who were traveling on the same flight. Call this fate. Let me introduce my guest to you. Dr. Rishabh Jain is a senior resident at the AIIMS New Delhi. Thank you very much. And Dr. Chakraborty is a senior resident as well at the All India Institute of Medical Sciences. Thank you both very much. And it was so good to see all your photographs. There were 5 of you on board that flight. It was so good to see your story on the front page of newspapers. Even better to see pictures, because there's so much negativity around news that it's just great to see something positive and good happening, happening in this country. And we know that there are enough good people in this country. Dr. Chakraborty, can I start by asking you how that entire experience felt? Are these moments that tell you, okay, this is what I was born for, this is why, I studied for years and years, cracked those really tough exams, this is the moment I was preparing for?
Yeah, definitely. I mean, I hope I don't have to encounter it again. But yes, I think, this is the culmination of all that we have prepared for. And I mean, yeah, we have exams, but this was like a real life exam that we had to. Usually, the patients that we deal with, it's in a very controlled setting in the hospital or ICU, and we usually have our entire team with us. Again, we had our team. It was a very unlikely team to have 3 radiologists, 1 obstetrician, and an anesthetist. But yeah, I'm happy it panned out well, at least in that point. Of course, the baby is not out of the woods yet, and it's a little premature to celebrate, but it was a small victory nevertheless.
It was a small victory. Can I ask you how this came about? Dr. Rishabh Jain, how were you on that flight? Because I'm sure the baby's parents are thanking God that all 5 of you were on that flight together. So how were you on that flight together, and what happens?
Yeah, so actually, we were heading back from Bangalore to Delhi. It was a conference that we were attending in Bangalore. It was a conference of the Indian Society of Intervention Radiology. And we were heading back from Bangalore to Delhi. And our flight was Vistara, UK 814, at 9:10 p.m. So at 9:30 p.m. In the airport, in the airplane, the crew announced a distress call that there is a very sick child and the mother is crying, and is there any doctor on board? So it was, I was sitting with my wife towards the back of the airplane, and soon, very instantly, my wife raised his hand that, yes, there is a doctor on board, and the crew member escorted her to the back of the plane. She examined the child. There was no pulse. The child was limp. He was all blue. He was cyanosed. And when she palpated the pulse, there was no pulse. So she immediately started chest compressions, and the rest of us followed suit. We entered the back of the airplane, looked at the situation. Luckily, one of the doctors on board with us was an anesthesiologist, Dr. Navdeep Kaur. And she, being a critical care physician, took in charge of the whole situation, became the team leader. And all of us, with the help of all the limited resources that were available in that plane. So there was a small cannula, a bag and mask of an adult size, and we started chest compressions, and whatever we have learned in our MBBS MD and in a sirship, that came to a real life use on that plane.
God, I mean, I hope, as Dr. Chakraborty said, you guys never have to encounter that situation again. But Dr. Chakraborty has often said, too many cooks spoil the broth. In this case, was it completely the opposite? That everyone was just grateful in this situation to have each other to consult and lean on?
Definitely. This was a situation as in, I did have a lot of people asking me that you guys look high school. Like, we were not. It was just a front. I mean, of course, we were able to remain a little calm because we had each other to, like you said, lean back on. And it was a very smooth operation in the sense of everybody very quietly and very efficiently just, um, uh, relinquished control to our appointed team leader. And, we just understood and fit into our roles very well. And everybody just, we had one person who was at the airway, one person who was doing compressions. We did not have any monitor. So this monitor that we see is actually the monitor that we found on the ambulance once we landed in Nagpur. On the flight, we did not have any monitor. So we had one person who was, after every 2 minutes of CPR, just checking whether we were able to revive the baby or not. One person who was mixing the drugs to the right concentration. One person, as Rishabh said, that Dr. Rishabh said that there was, we did not, it was a slightly suboptimal. The flight did have a lot of the equipment, but most of it was to cater to adults. So we had one person who was, sort of trying to create a makeshift situation wherein we could use these equipment for the baby as well. And of course, in the middle, we also had to keep talking with the parents who were naturally very distraught at that time, and the crew members who were absolute gems. They, listened to us. They listened to the tea. Like whatever we asked for them to divert the flight. We asked for certain things to help us create the equipment. And they just did whatever we asked of them. So they were also very cooperative. Yeah.
Dr. Rishabh, have you heard back since from Vistara or the parents? Because Dr. Chakraborty is telling us that the baby is still not out of the woods. So maybe no reason to celebrate. Premature celebrations may not be in order. But it was a small victory in any case. I will say that it was fate, actually, that had all 5 of you on that airplane. But have you heard from the parents since or from Vistara?
So we haven't heard. I haven't heard from Vistara yet. But there was a comment that it was a press release by the Kingsway Hospital where the child is admitted currently. And they mentioned in the press release that the child is still in the critical condition and on ventilator and drugs. And the parents have been counseled accordingly. But let's see what happens. Let's keep our fingers crossed. I really want the child to make it through.
Yeah, we are really rooting for her. Yeah.
Well, I'm 100% sure, actually, that the baby will make it. I have no doubt in my head. But Dr. Chakraborty and Dr. Jain, before I let you go, for you, what was the big learning? What's something that will stay with you forever? Because I think this is a moment that will probably stay with all 5 of you for the rest of your lives. And you have really long lives ahead. You have really long practicing careers ahead. But do you think this probably would be a highlight for you for the rest of your life, Dr. Chakraborty?
Yeah, definitely. It's not every day this happens, and I hope it doesn't happen every day. But yeah, it's something that's going to stay with me for a very, very long time. In fact, I'm still a little shaky because it ended up well in that moment, but it could have gone terribly wrong. So I'm still not, there are times I can't believe we were able to revive her because in conditions like these, you don't know whether, this person's going to get up or not. They're going to have their heart beating back again or not. But yeah, one takeaway definitely I had from this entire incident was not just for doctors, but everybody who can should learn basic life support because we helped with the equipment, but most of what we did was there was something that was pretty basic, like chest compressions and giving breath to the baby. That is something that you don't require a medical degree for. So that was a huge takeaway that especially on flights, I think it will be helpful if, we have a couple of the crew who are well versed in this. Because it won't be every day that, the stroke of luck that you have medical professions on board.
That's a very good suggestion, actually. Dr. Jain, did equations change given the fact that this was a baby you're dealing with? And, you'll put your soul and heart into what you're doing for every patient, I'm sure of that. But when a baby comes along and when you're treating a baby, there's just so much more emotion that goes into it.
Definitely, definitely. And to top of it, it was not a normal baby. So the baby had a congenital heart disease. So he was operated in Bangalore 20 days ago. And the parents, along with the baby, were flying from Bangalore to Delhi for the return flight. And so he had an open heart surgery done in Bangalore. And so it was a very high risk baby to start with. And there were definitely challenges when you are resuscitating a baby, because the veins are small. You can't put in a cannula like you can put in an adult. So you need trained staff for that. The sizes of equipment that are available on the board are mostly adult size. So you have to kind of makeshift equipment so that they fit into the child's resuscitation efforts. So it was definitely a big challenge. And in hindsight, I would say that if any one of us was alone in that flight, I'm sure maybe the outcome would not have been so smooth as it happened when all five of us were there.
As I said, it was fated that all five of you, were in the same flight. And I have no doubt that the baby will make it. We'll just ask all our viewers to send a little prayer up tonight for the little baby to make it. You're telling us that he's not completely out of the woods. So we are all praying that he does come out of the woods and he grows up to be a healthy and happy child. And someone who I hope when he grows up comes back to meet you guys. Thank you very much. Thanks, Dr. Rishabh Jain, for joining us. Thank you so much. Dr. Chakraborty, good to have you on the show as well. Thank you very much.